All right. Good morning, folks. Welcome to our Wednesday press conference. I have a few remarks to make before I take your questions. I want to give some shout outs to my staff. First, Dr. Kimberly Hardy, my Director of Nursing. Our testing program has just run fantastically. I conceived it, but she brought it to fruition. I want to give a shout out to Kim again. All of my public health nurses who are out working in the heat, actually collecting the samples, and then all the other Pitt County Health Department staff who are there in support roles, helping this testing operation be successful. I'm pleased to announce that through yesterday evening, we have tested 3,424 individuals from Pitt County. That's a great number, a much larger number than we thought we would test in the program. And by the time this wraps up on August 14th, this first phase of testing here in Pitt County, we will be somewhere above 6,000 people tested, which is a great number. With that, obviously, comes an increase in the number of cases that we find. From an epidemiologic standpoint, what we are engaging in is called active case finding. So if we have no requirement that an individual be sick or have been exposed to be tested. They only have to present to a testing site and want to be tested, and we will test them. So we are testing anyone with symptoms. We are testing anyone without symptoms. We are testing those who are exposed and those who are not known to be exposed. So we are engaged in what is called active case finding, and yes, we are finding cases. As of this morning, the state and us agree that we have 1,548 total cases. As of yesterday, we had 977 of those cases recovered. This morning, we haven't updated our recovered count yet, but we will be over 1,000 cases recovered in Pitt County today, and that number will be posted later. It's 1,008 people recovered. If we use yesterday's numbers, and I know sometimes it's hard to follow numbers when people just talk through it, if we take the 1,548 total cases, subtract the 977 cases that we consider recovered, and meaning that those cases are more than 15 days old, they're 15 days or more old, we have what we would estimate to be 571 active cases in Pitt County. If we divide that by our estimated population of 185,000 people in Pitt County, it gives us a number of 0.0031. That means that 3.1 people out of every 1,000 in Pitt County have an active case of COVID-19 at this time. So for you personally to meet someone, unless you have very bad luck, with COVID-19, an active case of COVID-19, you'd have to run into about 333 people before you hit that one person who has COVID-19, active COVID-19. That doesn't mean don't protect yourself. It doesn't mean don't wear your mask. It doesn't mean don't wash your hands. We need to do all of those things. We need to continue to maintain our spacing to keep that 6-foot separation from people to try to slow or impede the transmission of this virus. But a rate of 3.1 per thousand is a fairly low rate of active disease in the county. So wanted to share that with you all this morning. And I think that's all the prepared remarks I have this morning. So I'm happy to take your questions.
Now we're seeing more restaurants close. We're seeing yesterday, Dunkin' Donuts, today we got several that are closed, and a few of those had positive COVID-19 issues. Is there any regulation how these restaurants are they supposed to close if someone has COVID-19, or is there any proper cleaning procedures or anything?
So the questions about restaurant closures with COVID-19, in general, we do not require the closing of restaurants because of an employee testing positive for COVID-19. Some restaurants choose to do that so that they break the cycle of transmission amongst their own employees. Some they do that so that they can do a deep cleaning in their restaurant. There is no known foodborne transmission of COVID-19. This is about respiratory droplets and mostly about respiratory droplets being passed directly from person to person. We have not demonstrated any foodborne transmission with this. So I think some of that is appearances. Sometimes it relates to staffing. If you have a limited number of staff and they're exposed and need to be quarantined, pending testing or just to complete their quarantine, that may limit the restaurant's ability to operate. But we in general do not require them to close for a single case in a restaurant.
You're seeing a lot of restaurants also now are just kind of closing down to sanitize and keep the area safe. You think it's a good practice?
I think it's a good practice. While we think that the transmission from solid surfaces or non-porous surfaces is less important, it doesn't mean that those shouldn't be cleaned. It's probably harder to get it from a solid surface or frequently touched surface than we originally thought, but it's important to sanitize areas that are used by more than one person to help reduce the risk of transmission from that surface.
And right now, we were talking a few minutes ago about the definition of quarantine compared to isolation.
Yeah, it's an important difference, and the reason that it's an important difference, even though functionally it's about the same thing, the public health law behind that is different. So quarantine implies the separation of individuals from society who have been exposed or believed to be exposed to an infection, and they can be quarantined for the period of what we call the incubation period of that infection. So for COVID-19, that's 14 days. So an exposed individual can be quarantined for up to 14 days after exposure to COVID-19. Isolation, we isolate people who are known to be infected with an infection of concern or highly suspected to be infected with the condition of concern. So with COVID-19, we now know the CDC has changed some guidance on that if someone is infected with COVID-19, that 10 days after they've been infected are known to be infected if they have improved, if their cough is better, if they're feeling better, if they have no fever for at least 24 hours without the use of medications. After 10 days, they can be released from isolation and would no longer be considered infectious.
If someone does have COVID-19 and they're at home, should they be doing anything to kind of, like medically, should they be doing anything, rest, those types of things?
Yeah, for most people with COVID-19, they'll likely experience a mild to moderate illness and may not need any specific medical care. So those typical things, medications like acetaminophen or Tylenol to lower their fever, lots of fluids, getting rest, and adhering to that isolation guideline where they stay isolated for at least the 10 days until they're improved so that they don't spread the infection to other people. If they have no means of getting food, they should not be out shopping for their own food. They should have a friend or a relative do their shopping for their food and not go out in public during that period of isolation.
And like you were saying, with the period of isolation, when should someone possibly come out of isolation? Is it a certain period after a fever lets go, those type of things? When should it come back?
The question is coming out of isolation. Again, the current CDC guidance says that at 10 days after the infection is diagnosed, provided there has been improvement in symptoms and no fever for at least the 24 hours preceding that 10th day with no medicines to reduce fever, that individual can be released from isolation. You're done, Brent? Questions about how do you know if you should be in isolation or quarantine. So right now, if someone's asymptomatic, we have not required them to quarantine during testing. If someone is sick and suspected of having the infection and is being tested because they're suspected of having the infection, then they should be in isolation until the results are known. The definition that we were given by the state epidemiologist, Dr. Zach Moore, was a positive COVID test, so a real-time PCR positive test, a clinical syndrome compatible with the COVID-19 illness, no period of recovery, and no other obvious cause of death. So if I have COVID-19 and somebody shoots me, and I died of the gunshot wound, it would not be a COVID-19 death. If I have a mild illness and I'm in a car accident and I die from injuries sustained in a car accident, that would also not be a COVID-19 death. If I die of respiratory failure from COVID-19, that would be listed as a COVID death. And we are now, Elizabeth, we're at 11 COVID-19 deaths, and this was another thing that I wanted to mention earlier, so thank you for bringing that up. When we look at the age distribution of our cases, 42% of our cases are in the 25 to 49-year-old age group, which is good because most of those folks will have a mild to moderate illness and probably not need a lot of medical care. 4% of our cases are in the 75 and older age group, and unfortunately, that is the age group that is very likely to have a severe outcome. And when we look at our deaths, 55% of our deaths have come from the 75 and older age group. Mm-hmm. I'm not sure why that is. We report the demographics that we have when we put that into the NC-ED system. And as far as I know, we've had the demographics on the individuals that have died. There were two death certificates that said coronavirus or COVID-19 without positive tests. So those were not listed in our deaths as coronavirus deaths because there was not a positive test to go with those. So I'm not sure why there's a discrepancy there. No, they were not tested at all in those two cases. That was the clinician's impression. And there are other coronaviruses, so just saying coronavirus on the death certificate does not mean COVID-19 necessarily. Yes. Okay.
So, you were talking about numbers a few minutes ago. You see a high number. That's
Mm-hmm.
because one thing, you guys are testing a lot of people in
Mm-hmm.
the area. So, let's talk about this. When you see it around the country, the numbers have increased, but the testing has also increased.
Yeah, Brandon, I wish I had a monitor this morning where I could show you the curve on the state website. And clearly, if you look at our curve, there from a line graph standpoint, there's a nice steady linear rise, never the geometric rise that we were concerned about. After the Memorial Day weekend, there was definitely an uptick, and we sort of hit a new sort of plateau after that. After the July 4th weekend, there's been an uptick again, with summertime mixing and mingling, a lot of barbecues, things like that. And then when you look at that graph, if you look on the day by day bar graph, our testing program began on July 13th, and so our curve looked relatively flat, and on July 13th it went, and it has stayed at that level with our increased testing. So the good news is that even though we're testing more people, our percentage of positive has remained at about 7%. And that's here in Pitt County. And then the other thing, and again, I don't speak for Vidant Health, but when Vidant looks at their system-wide testing, they're running about 7% in their system-wide testing too. So that's across all of the 29 counties that they serve. Yeah, prior to COVID-19 or what is now sometimes called SARS-CoV-2, there were 4 known human coronaviruses that produce respiratory diseases, and they typically produce things like winter colds, bronchitis. Rarely would they produce a pneumonia. There's a well-documented outbreak of coronavirus at Camp Lejeune from, I think, the 1980s. That was a coronavirus outbreak amongst Marine recruits. There's also a less well-characterized group of coronaviruses that cause gastrointestinal illness, nausea, vomiting, diarrhea, that were known to be human pathogens prior to COVID-19. COVID-19 is a novel virus. It was originally a bat coronavirus, which was able to make the jump to humans and has unfortunately become a very well-adapted virus to humans as a host for itself. Okay, thank you. You guys good? All right, thank you, folks.
So good morning. I'm Jennifer Johnson, the Public Information Officer for Pitt County Schools. Also in attendance today, we have our Superintendent, Dr. Linker, who will be here, and our Board Chair, Ms. Betsy Flanagan, to answer questions for you. First of all, we'd like to say thank you to Dr. Silvernail and our partners at the Pitt County Health Department for their leadership in the community. Your work is appreciated by many, and Pitt County Schools considers it a privilege to partner with you as we've sought advisement regarding the upcoming school year. For our community, our parents, our staff, and our students, as you may know, Pitt County Schools is operating under the guidance of our governor's office, the North Carolina Department of Public Instruction, the North Carolina Department of Health and Human Services, and yes, our local health department. We do this in order to safely reopen and operate schools beginning on August 17th. So to recap the most recent events, on July 14th, 2020, Governor Cooper announced that public schools may choose to reopen for in-person instruction, but with reduced capacity and utilizing strict safety precautions. On July 20th, after extensive reports and advisement from administrative leadership at PCS and the Pitt County Health Department, the Board of Education voted to allow in-person instruction to begin August 17th, while also allowing parents to choose virtual options. For our face-to-face options, the board agreed with the recommendation of alternating weeks of instruction for students and families. Through July 27th, at Pitt County School, all Pitt County Schools parents were asked to register their children for the fall semester with the ability to choose face-to-face options or 100% virtual options. Our virtual options are designed to help accommodate a variety of parent schedules and specific family situations due to the current pandemic. Based on our registration, we know that around 42% of parents in Pitt County are choosing 100% virtual for students, while approximately 58% of students will begin the school year with face-to-face and alternating virtual instruction. We also know that around 25% of our students will need PCS bus transportation. In order to adhere to the guidelines set forth by the state, we are now hand scheduling students according to the chosen learning option that best fits their family's needs. We are also continuing to prepare our buildings and our buses to receive students. Under the most current guidance, families can expect the following if returning to school in person: greatly reduced capacity of students, staff, or visitors in our facilities at any given time. Social distancing as a requirement for all. Masks as a requirement for all. Daily temperature checks and symptom screening for all. Daily and routine cleaning and sanitizing of all schools, facilities, and buses. Those participating in virtual learning can expect streamlined instruction, direct interaction with our teachers, and full accountability with new curriculum and graded activities and assignments. Also, Pitt County Schools is proud to announce that we will be providing devices to all students this year to utilize during remote learning times. Again, our system will be a one-to-one system in the fall, with all of our students having access to a device for the 2020-2021 school year. We assure our parents and our teachers that PCS has been diligently working and planning for months for the beginning of the 2020-2021 school year. We have submitted our official remote learning plan to the North Carolina Department of Public Instruction and are awaiting final approval. And we are continuing to prepare our facilities and to train and inform our teachers and our staff as they return to work. We know that there are lots of questions, and we've been dedicated to authentic, frequent, and informative communication since school closures happened in March. For information on our 2020 Road to Reopening process, we ask that you visit our website at pittschools.org, where you'll find our guiding documents, informative videos, interviews with PCS leaders, frequently asked questions, and much more. We also advise parents to follow us on social media and to watch for district updates through direct emails and phone calls. Again, we thank you for your patience and support as we prepare to return to school safely beginning August 17th, 2020. And now I'll turn it over to Dr. Linker and Ms. Flanagan for questions.
Great job, Jennifer. Hello.
Quick question. You guys are, with people that are coming face to face in schools, is it going to be alternate? Is it 1 week on, 1 week off?
Correct.
Home?
Correct. Yes.
Talk about what they'll be doing.
Well, we'll
They have a device at home.
right. We'll start the first week of school, August 17th. That first week that the General Assembly moved up. That will actually be what we're calling the first week. We're actually bringing in kids on a different schedule, but that'll be announced in the next couple of days. That'll allow kids to get their devices and get access to their passwords and emails. We'll also be able to do that during open house the week before. But that first week will be a little different. And then we're actually going into the second week of school, which will be like week A. And then those kids will be face-to-face with their teachers. And then the other students, week B students or so, or will be at home during that week, and they'll be interacting with their teacher through Zoom meetings or through Canvas, which is our learning management system, or either Seesaw if they're on the younger students. So they'll be interacting, doing the same type of lessons, because the following week, those students in week B will then be face-to-face with their teacher. And then the week A students will be at home, again, doing the same type of lessons that the teachers are doing live with the other students.
Good to kind of hear the school get back and kids are getting back to school now.
Yes.
I don't really have any other questions.
Question is the number of students in each class. That'll actually vary a little bit by school, depending on how many students or how many parents or families chose the virtual option. So, but if a typical class would have, 20 to 25 kids, and some classes I know are larger, but if a typical class would have 25 kids in it, as a rule, we're 42% of our students are taking virtual, so that could knock that class down to 16, 17. Then you could have half of that number 1 week, so 7, 8, 9 kids at a time, depending on the size of the room. Some of our rooms will easily hold 13 or 14, socially distanced. Some of our rooms will hold 9 or 10. So it really depends on the size of the room, the teacher's classroom, how many students will actually be in there. Gosh, I hope not. Right. Well, sure. Well, we're doing different plans with our substitute teachers. So we are following the guidelines set out by the NC Toolkit, the Safe Schools Toolkit, that'll actually tell you what to do. We have our COVID contacts is what we're calling them within each school. So if a student or a teacher would come with a temperature or get symptoms or, heaven forbid, be positive, then we have a plan in which we go through we have our student services and our nurses are all on board. They will work directly with Dr. Silvernail in his office. We'll follow guidelines on exactly what students need to do and what students need to go home for quarantine or isolation, which students do not. And our goal is to keep kids in small pods. So our students are not moving as much as possible. That's also very hard to do at a high school. But in the elementary schools, we can have our students in pods. So they will not be changing classes. So if a student in this classroom does, get symptoms or test positive, we'll be able to work within that classroom and within that teacher, and won't have to shut down the entire school necessarily. And we'll certainly work with our local health department on what we have to do. But we have those plans all sketched out. That's more of an elementary middle approach. High schools, there will be some classrooms that are changing. There are also one-way halls. We also have cleaning between classrooms, between classes. We have wipes and/or sprays for every classroom. So you'll be able to clean the classroom when the kids leave, but walk in one-way halls. Again, just keep in mind that, take one of our bigger high schools, South Central, Conley, Rose, 1,600 kids, but you have, 500 of them not coming to school anyway. So then you're down to half of that. So 550 kids at a time for a school that's built for 1,600. We'll be able to socially distance those classrooms and those students. Now, playgrounds won't be open. There will be recess time. There will be things we're calling mask breaks because, I know these aren't fun. I know the teachers aren't going to enjoy teaching with them on. Kids aren't going to enjoy sitting with them on, but that's necessary at this time. But we will be working in mask breaks for kids so they can go outside and get some air and breathe and even run a little bit as long as we stay apart and be able to do that. Depends on the campus. Every campus is, some of our schools, they have those star type wings that go out. So you could have somebody here in each of the areas, and then that can then be spread out. But obviously it'll be done under the state guidance of everything else. I mean, you got to be 6 feet apart, and that's a rule we're obviously following very closely. Okay, thank you.